I ring Angie? Angie. Do I ring the bell? Angie. Do I ring the bell? Welcome everyone to Downtown Rotary. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all so much for being here. For those of you I don't know, who don't know me, I'm Cindy Peterson and I'm filling in for Tony, who is enjoying some much needed family vacation time. At this time, I'll invite Eric Ellefson to do our invocation.
It's a bit of a group to get up here today. All right, will you pray with me, please? Heavenly Father, as we gather, we praise for you for this day and for this purpose for it. Reset our agendas as we sit in your presence, for you assure us that where two or more are gathered in your name, you are here. We calibrate our intentions and refocus our hearts. Come fully into our situation, both as a group and individually. Today we lift up those who may be struggling. Give them the courage to seek help, to talk openly, and to find a path forward, whatever path that may be for their individual situation. Cover us with a blanket of honesty and patience for ourselves and for those around us, and to help us find our own way closer to you, Lord. In your heavenly name we pray. Amen.
We have one piece of exciting celebratory Rotary business today. While Darla makes her way up to the stage, I would like to thank Angie and Eric for being our greeters today. What a wonderful smile when we all walk in. Thank you. You do such a nice job. So grateful for that. Those of you who might not know Darla Van Rosendale, do I say that correctly?
You said it right.
Okay. We are celebrating Darla today as she receives her Paul Harris Fellow +1. And for those of you who don't know, established in 1957, the Paul Harris Fellow recognition acknowledges individuals who contribute or have had contributions made in their name of $1,000 or greater to the Rotary Foundation. Darla, thank you so much for doing that for this organization.
You are welcome.
Appreciate
My pleasure. Thank you.
We'll take a picture. Should we start calling that the picture pause after we do a new member induction or something celebratory in that way? But what's fun is we get to jump right into our program today. I am particularly excited about today's program. It's all about children's mental health. We have panelists Dr. Teresa Boysen, the Assistant Superintendent for Academic Advancement for the Sioux Falls School District, Thomas Otten, Assistant Vice President for Behavioral Health Services at Avera, and our Mayor, Paul TenHaken. Downtown Rotarian Lindsey Meyers with Avera Health is moderating today's program. And with that, Lindsey, I think you've brought some guests, and I'll let you cover any other introductions. So glad to have all of you here today.
Thank you, Cindy. Well, I'll introduce my guests because I think I brought the most today. So I'd like to introduce Mickey Lundin and Lena Tran. They're on our marketing team for Avera, and they have helped to do a lot of the preparation for our event that we have this Friday that we'll be telling you more about today. So thank you for having us today. It can often be said that community's wellness can be measured by the wellness of our youth and our children, so the future of our community. So that's really what we're going to be focusing on today, is we're going to be talking about children's mental wellness, a bit of a state of the state, and then some initiatives that are underway to help with children's mental wellness, and what each one of you can do as business leaders in our community to help to impact that topic. So that's what we're going to talk about. And so let's dive right in. Thomas, I'm going to actually start with you on this panel and have you talk with us a bit about what you're seeing at Avera. Avera Behavioral Health has the inpatient beds for about a 250-mile radius. What you're seeing as far as inpatient and outpatient care when it comes to youth and children right now.
Sure. So I'll start at the very high level. 1 in 5 kids has a mental health diagnosable disease. And over the course of the last 18 months, that has escalated. I would say, particularly at Avera, we had the busiest summer of all time in 2020. And now we're just finishing up 2021 summer, and it was considerably busier than 2020 was. So it has been definitely busy, both inpatient and outpatient. I would say a nod to our Sioux Falls schools. If you look at communities across the country where schools were shut down, it is considerably worse. School is a very important component of kids' lives, even though they might tell you they don't like school. Socially, emotionally, academically, being in school and being there is really, really important. And so I think it could have been worse. I guess I'll say that, but it's definitely an important thing for us to focus on. Over the course of the last year, the 2020 numbers had just come out on suicides and overdoses. 50,000, this is across America, 50,000 suicides last year, 93,000 overdose deaths, which leads to almost 400 people every single day dying what I would call a very preventable death. And it's sobering statistics to think about. I'll close it with at least one positive thing when you look across the country. In 2020, overdose deaths, as I said, was 93,000. There were 2 states that went down, 48 states went up. New Hampshire and South Dakota were the 2 states that went down. So clearly we're not ready to say we have it solved here in South Dakota, or that we've got the key ingredients, but I do think there are positive things happening here, and so that's something we should be happy for.
I know we feel one is too many oftentimes, but good to hear that it's heading in the right direction in South Dakota. Dr. Boysen, I'm going to go to you next. So what are you seeing as far as the Sioux Falls Public School District? I have 2 little boys who are in your school district. What are you seeing as far as the state of mental wellness with the children you serve?
Before COVID, we know we had concerns with mental wellness and supports needed to support our students, whether that's in our building or community outreach with our business partners. And so then when COVID hit, those numbers, the students weren't in school for that 9 weeks. We went home for the summer of 2020. And then we were very thankful to be back in school last August and get started and continue and stay in school all year. And when students are with us in school, we're able to wrap our arms around them, reach out to families and get connections with families. And so that is so important to be able to have those connections, because we do see the increase. And as we came back in, as with all students and families, everybody experienced some type of loss, or there was concern of uncertainty with the pandemic. And so how do we help support them? And when you think of the Sioux Falls School District or any school district, we are unique because we serve students and we serve adults. And so how do you help your students, but how do you help adults also? And so making sure that you have supports for your whole student body, but your whole staff also. So really wrapping your arms around that to support them.
Was the mental health impact a big consideration for the school district? I'm sure you saw school districts all over the United States. Some of them were out of school, some of them were in school. Was that a big point of consideration for you?
Dr. Stavum's leadership with our Return to Learn plan last year and really helping to support them, knowing that we had supports within the school district with our counselors, our social workers, the support of the medical community coming alongside us as we put that plan together, and knowing that if we needed to pivot, we would pivot, but the concern for our students and our staff coming back, and how do you support them all so they feel comfortable, and giving them different options. And we were able to give them different options that help families feel comfortable with their return last year.
Thank you. Mayor, we're tickled to have you here with us. Obviously, you have major concerns over the state of how children are feeling as far as mental wellness in our community. What are you seeing as far as the services you provide, both at the community health clinic and then through police and fire and rescue?
Yeah. Well, first off, thanks for having this panel. I think it's a really, really important discussion for a variety of reasons. One is a lot of times when we talk about mental health in our community, there seems to be more of an adult focus, and we don't often think about the kids and the youth, especially how they've been impacted this last year, as Thomas alluded to. For those of you who don't know this, we operate a clinic in the city of Sioux Falls, Falls Community Health. We have 60 to 70 people on that staff, and we provide clinical services to people in our community who basically can't get care anywhere else. We also operate 3 school-based clinics in Hawthorne and Terry Redland and in Hayward in conjunction with the Sioux Falls School District. And so I reached out to some of our providers that do care in the schools and asked them what they're seeing, and they ballparked it that roughly 50% of the kids that are experiencing challenges in school for some reason or another that they're seeing have some sort of mental health challenge as a reason for their struggle, whatever it is. But the number one issue that kids experiencing mental health challenges can bring to a school is they're simply disruptive in the classroom. They're very hard kids to have in the classroom. And so while initially the focus may be on that one youth, that affects the other 20, 25, 30 kids all around them. The educator as well, who is flustered trying to deal with this student with these challenges. So the ripple effects of one kid who can be experiencing some trauma and some mental health challenges can really have a pretty large impact. I asked one of our providers, I said, give me some thoughts on how you feel the mental health challenges that you're seeing in kids are affecting the community as a whole. And she sent me this paragraph, which I just wanted to read. She said, we see mental health and addiction issues becoming more serious as they're engaging in more risky behaviors, kids with mental health challenges, such as drugs, crime, pornography, inappropriate sexual behavior, making other poor choices that can have serious consequences. Depression and anxiety also worsen as children get older if they're not treated and taken care of early on. When we look at female children in adolescence, many are also dealing with issues related to feelings of self-worth. And these are real issues that require a team-based approach to help our youth. So that's one of our practitioners. So, what's the role in the city in that? Well, it's such a collective challenge that we all kind of play a different role. I think one specific program that I really want to spotlight is our SRO program in schools, because there was a movement this past year that some communities got rid of school resource officers in their schools. They wanted to, demilitarize their schools and not have cops in the schools and for the message sent. And a lot of times those officers play a critical connection in helping determine what's wrong with a kid's life. A lot of times those cops can get stuff out of those kids that no one else can. They become friends, allies. And so we're really thankful for that partnership with the Sioux Falls School District, because I think that's one program that we have that has really helped us deal with some of the struggling youth in our community, specifically those that have some of those mental health issues.
Thank you.
If I could piggyback on that really
Yes.
quickly, just, one of the things you said that's really important is so many of the kids that need help don't reach out for help. It's a very complex thing that goes for adults as well, but well over 33%, so well over a third who have a issue, it's identified, it's screened, still don't reach out for help. And there's, probably a variety of reasons for that, but probably by far the most important is the stigma that's related to behavioral health diseases. And what other disease state would we say, yep, you've got X, diabetes, cancer, you name it, and 36% wouldn't get help. So it's an important component that as a community, we need to do a great job of saying, how can we make this easier to access?
How do we help with that stigma also, Thomas, that people face around mental health that they wouldn't normally face around other disease categories? Like if someone had heart disease or cancer, you wouldn't hesitate to reach out to them, but it seems to be hard to reach out when people have mental illness.
Yeah, I'd say there's a whole bunch of things. I'll start with, when we have meetings like this with business leaders to talk about mental health, that matters. It matters when we build facilities that are world-class facilities that are, just like the heart hospital should have a fabulous facility for those who have a heart condition, the behavioral health hospital should have a fabulous facility for those who have a brain condition. It matters when, the community and the city and agencies step up, the city, county, hospital step up and say, we're going to create the link, a program that's designed 85% of which is homeless. I mean, there's not going to be any money made on that program, I can promise you that. But it matters when we say, these people matter to us. So I think even, our mayor and our city council step up and say, we're going to give $500,000. We're going to set it aside and call it Operation Hope. And we're going to give $500 to people who are in a desperate time in their life. It might be to help with mental health co-pays. It might be to help with transportation. It might be to help with, transitional housing, a variety of different things. Those kind of things matter. And when you do the opposite of those things, it matters too. I mean, it definitely sends a message. So I think step one is just making it more acceptable to have a mental health disease. And I will say in Sioux Falls, we're doing better. When we built behavioral health building that we're currently in 2006, we had an average daily census in the high 30s. The average daily census for this summer, which the summer is always our slowest season, has been over 100. There's a wide variety of reasons for that. And as I alluded to earlier, COVID is certainly a piece of that. But I will say one of the things that's very different today than it was in 2006 is when business leaders and doctors and lawyers and their spouses need care, they come to Avera Behavioral Health. And 15 years ago, we didn't see any of those people. They were getting out of Dodge. If they really needed that kind of care, they were going to Mayo or they were going someplace other than Avera. And so I think we're making progress. I clearly would not say we're there, but I think we're making progress to say this is a brain disorder. Let's make it easy for people to get help.
I think one really powerful point that you brought across there too is that people can't do it alone. Communities can't make change alone. And so that's the whole reason we're having this conversation today, right? Is because it's going to take all of us to make change and to help children and youth to feel more comfortable with talking about mental wellness. So this conference that you're having on Friday, Dr. Boysen actually started with a pretty informal conversation between us to say, how can we start to work upstream with children's mental wellness? So do you want to tell us about the conference that you're having for the Teachers Friday and what's been involved?
Right. It was a great opportunity, and it started with a conversation about how can we partner together and what is a need in the community. So not just the school district, but in the community, and mental wellness was the topic. And as we continued those conversations with Avera, anxiety, depression surfaced. And so through that conversation, we involved our counselors, our social workers, our nurses in that, and our curriculum coordinators to say what would be the need for our staff in the Sioux Falls School District, and partner with Avera and your practitioners alongside us so we can do the work together. Because we know if we can make a difference with our staff that touch the students' lives, maybe we can, as they're out in the community, we can see the results of that work. So that's been a 2-year conversation, and we're so very thankful that on Friday, we're gonna bring 3,000 people together in the Sioux Falls Convention Center and really talk about anxiety and how it presents itself in students. And we know it presents itself differently for elementary, middle, and high school. So we'll have all our nurses, our social workers, our educational assistants, our teachers, our administrators in that room alongside Avera staff to really dig deeper into that topic. And so that way they're going to listen to information, but they're going to leave with some information. And together we created tip sheets at each level, but it really talks to, the teachers will take these with them, but this is what anxiety might look like in a student. Is it a first-time situation? And how do you help build their capacity so they can work through that situation, or if more support's needed, who can help support them? And within the building, that's our first defense. And if there's more support needed, we do have community partners with Avera Behavioral Health, Lutheran Social Services, and so that way the counselor would be able to refer them out. So it's been a 2-year process, and it's coming together. We'll spend the whole morning together, and Lynn Lyons will speak to us, and she'll help staff identify what it is that students need. And when we listen to Lynn speak, we really could listen as a teacher, I could listen as a parent, I could listen as a community member, because I know that as I'm out in the community working, I could be a coach for a Little League team, and I could help support students working through frustration, or give them the words that they need to practice, because we know that sometimes worry, it starts with worry, but it moves into anxiety. So when that worry pivots over to anxiety, how can I help a student work through some of those frustrations? Just like you spoke about, sometimes it presents itself as a behavior, but how do we help them then to push through and use some of the strategies that we'll be equipping our staff with, and then we'll continually spiral around throughout the year, so that way our staff, it's not just a one-time conversation. We'll talk about anxiety and the strategies throughout the year in the Sioux Falls School District.
I don't know anyone who hasn't experienced anxiety during the last 18 months of what we've been going through in the United States. So it's definitely been more prevalent. But Thomas, what are you hoping to?
I think
out of
from the
this?
Avera side, I would say, Dr. Boysen did a great job of explaining what we're trying to accomplish. From Avera, I would say, one of the things that's important to us, teachers and school personnel in general are heroes. I bet you money I could go throughout this room and ask, do you have a favorite teacher that made an impact on you? And I almost guarantee you every one of you would. I know it's true for me. And I think we're just, we saw this opportunity to say, hey, we could potentially equip teachers with what to say when these difficult situations come up. As Dr. Boysen pointed out, it's not just, 2 hours of kind of a sit and get. It's more, how do we give coping skills to kids? How do we teach teachers, conversations to begin? How do we look at how we can do this? The teachers feel well equipped to handle with those kinds of situations. So we're super excited about, this opportunity to have 3,500 or 3,000 teachers and school personnel there.
And so as we're hearing, our teachers are really mentoring our youth. And Mayor, I know you have a huge mentorship initiative that you've started in Sioux Falls. And I'm just wondering, you're about a year and a half into that initiative. What kind of outcomes are you seeing, and what do you hope the future will look like from that?
Well, yeah, I don't have to preach to the choir in this room, because you guys have all heard, and I know this club's a big part of mentoring, and you've heard about how important it is to me. But I think the last year has poured gas on the mentorship need fire, really, more than ever before. And I do also believe it's going to be a little while before we know some of the effects that the past year have had on kids and on youth. I think we're learning more every day. And I know sometimes even my own kids will say something that I didn't think they had any clue what was going on and how they're processing what's happening in the world right now. It's very interesting. So mentorship to me is a perfect answer to one of the mental health challenges we have, in that a lot of times these youth that don't have a mom or a dad or a father figure or a mother figure in their life, there's no one maybe helping identify the need that this kid is having and the things that this kid may or may not be saying, that it's like something might be off here. Why would you say that? Help me uncover that. Ask the right questions, probe, just be there for that youth. And so if no one's doing that for a child, that's how that undiagnosed, case can progress and continue, and then they look to other coping mechanisms that are not productive. And so I continue to feel that mentorship is one of the best solutions to a bevy of challenges we face in the community. I think one of the issues we have to address in this conversation is technology and social media and the detrimental effect of social media on youth. And as a guy who worked in that industry for many, many years, a lot of kids' mental self-worth and their mental psyche is formed by what they're consuming electronically. And it's very hard as a parent of a 15, 12, and 8-year-old to disconnect them from that world because everybody else does it. So how do you be the dad that says, no, you can't? And how do you be the kid that doesn't have access to that technology? But we have to address the technology issue, because when you look at issues of self-worth, and you look at issues of bullying, and you look at issues of suicide, and you look at issues of chemical dependency use, there's a social media thread connected through a lot of that with our youth. And so I don't have a solution. I wish it was easy as having a solution. I just know that we have to recognize that problem, because it's a growing problem.
Sounds like an opportunity for next year's conference, possibly. But
Yeah.
Thomas, do you have any clinical advice for, as we look at, I know you've talked about the impact on social media and our youth. How much of an impact is it?
Yeah.
And how do we work with it?
It's a monster that no man can tame. I will say that. I think, social media, for a whole variety of reasons, is really kind of a highlight reel. And when I look at social media, and I say that not personally because I don't have any social media, but when a person looks at social media, you see how glorious everything looks. If you just look at a Facebook picture and they're out, camping, and they're by the fire, and, they say, man, what a wonderful weekend I had. It feels like that's what everybody's life is like. And my life isn't like that, because when I went out camping, I slipped in the river and cracked my head, and, who knows what happened when I went out camping. I mean, it's a very artificial world. And I will tell you, there is a ton of research about the evil of Facebook specifically, because it, is kind of the biggest and first. The relationship between social media and mental health issues is very, very significant. I don't think, as Mayor Hansen said, it's extremely
Mayor
hard.
TenHaken. You're living 20 years ago, brother. I wasn't going to let that one go.
Okay, that's my most embarrassing moment. As Mayor TenHaken said.
It's all right. Nobody was watching, I'm sure.
It is really hard to be the parent who says, no, you can't have Facebook, or you can't have Instagram, or you can't have Snapchat, or you can't have any of these things, all of which are very dangerous. Snapchat may be the most dangerous of all of them. I do think the answer is somewhere in moderation. I am thankful that I raised most of my kids when they were younger, and cell phones weren't quite as big of a thing, but, we were very targeted with moderation of, you get 60 minutes of tube time, whether that's, TV, video games, phone time, and we would expand that on weekends and a few things. But, moderation is really, really important on these things, because I'll bet if you take your child's cell phone device and go to look at the settings and figure out how much time are you on the cell phone, it's going to surprise you. How much time kids spend on their cell phone, and it's a very dangerous piece.
I think it's surprising to us as adults sometimes when we see that notification pop up. Mine pops up every Sunday to tell me how much I was on my phone last week, and it's kind of a surprise to me too. Dr. Boysen, your teachers are right there on the front line. So what Paul and Thomas were talking about, it's they're seeing it. You can't tell always by the clothes the child wears and, what kind of their situation is at home. So how do you help equip your teachers, every day to help to look for these issues and get kids to their right level of care?
So teachers, that's the best thing, that the relationship, and really building that relationship with all their students. And that looks very different at elementary to high school, but teachers are expert in that field of building that relationship with students and really keeping a careful eye out, because you do notice when something changes, whether it's all of a sudden they're not turning in an assignment, or their appearance looks different, and then really taking time to visit with them, and who's the person to best visit with them. If I have a connection with them as the building principal, I have that conversation. If it's the English teacher or the math teacher or the coach or the counselor, just really to zone in to that conversation with that student. We always say that everybody needs another caring adult in their life. And so sometimes we want as many mentors as we can have, because I truly believe everybody needs one more caring adult. Even if I have 2 parents or 4 parents. I need one more adult that I might share something with that I wouldn't share with my parent. And so who's that caring adult in that school that can connect with that child? And then do they need to visit with our school counselor? And our school counselor is there to help listen a little bit more carefully, have those deeper conversations with them, and then reach out to the family. And I think that's our first line of defense, and really building that trust with that family, because if they trust us in the school, then they'll come to us with questions and concerns also, and then we can help them get the supports they need. And if that might be referring them out to another agency, we have those all those processes in line to help support those families.
So let's talk a little bit about the services that are available for children within our community. We have a whole variety available, and I know we touched briefly on the link, which is for adults, but I think that's going to make a huge impact just in addiction and some of the things that we're doing in our community. But Paul, anything you want to highlight there, and then I'll go to Thomas to talk a little bit about our.
Well, Thomas alluded to the fact that the link's not going to make any money. Okay, and so I want to touch on that a little bit, because the link's been open now for a couple months. And again, for those of you not familiar with it, real quickly, the link is a triage center, or a link for people in our community to services that they need as a result of suffering from chronic addiction or mental health, behavioral health challenges. So, when you're a hammer, everything looks like a nail. You've heard that before. We get a little bit of that with some of our first responders or cops. We're dealing with some of the same people, and they use the tools that are at their disposal. And so we had to get them some new tools to use. And the link is one of them, where they can take these men and women suffering, and they can get diagnosed and determine, is this an incarceration issue? Is this a treatment issue? Is there a medical issue here? How can we better serve this population in our community? Avera is our contracted provider who runs that facility. And I tell you, this has been a huge labor of love to get this project put together. Commissioner Dean Karski's here, big champion from the county. Obviously, Avera, Sanford, and then my office came together to get this done. But when you get those 4 groups working together, it's very hard, because all of us have different expectations of what we want to see the link do in our community. These guys at Avera stepped up, responded to the RFP, are running the facility, and I'll be surprised if they make 4 figures on this. I mean, they're going to break even on this, because it's a commitment to their mission of serving the least of these in our community. And so they've been an incredible partner. But you cannot take care of the mental health challenges with kids until you've taken care of the challenges with their parents. So if the parents aren't well, they're not going to be investing in their kids. So the link does focus on adult needs, right? We don't serve youth there. Youth, there is a gap in our community for services for youth. And people ask me about that a lot. Can I take my kid to the link? Can I take this young person? It's an adult facility right now. But we're using this model to figure out, okay, how can we take this link model, and maybe there's a way to grow this into an expanded youth concept down the road. We're 3 months into this, trying to figure out the data, looking at the data, seeing where we're getting people from, how many of the same people are coming through the door, how many people are we diverting from the emergency departments at Avera and Sanford, who are taking up emergency room beds, and now we're able to take care of them there, and for sobering and detox and so forth. So I just have to put a plug in to Avera, Sanford, and Minnehaha County for the partnership on this, because I think it takes a special group of people to come together to make something like this happen. So you asked earlier, how do we change the stigma? Well, you put your money where your mouth is, and you invest dollars in things that, okay, this isn't a park, this isn't an ice skating ribbon. Okay, we're putting money into a program like this because the need is great. And as our city grows, and we just got our census numbers, and the population is growing incredibly fast here right now. And a lot of times the exciting thing to do is to talk about all the fun things of growth, okay? And the economic development, low unemployment, just how things are just humming in the economy, and they are. But with that comes all these challenges, and the mental health challenges, and the housing challenges, and the diversity challenges, and challenges in our school district. And I think we have a responsibility as a community to not focus too much on this at the detriment of this, and make sure that stays balanced. I think the link is a testament to that.
And Thomas, I know you're adding more services to the mayor's point that'll help with some of those areas. I mean, addictions had a real light shown on it because of programs like Emily's Hope and different areas that we've been working on. So what will your new building project that we can all see rising out of the ground there by Avera Behavioral Health, what will that add to the community that we haven't had before?
Yeah, great question. So it's 4-story building, $28.5 million. Essentially, it'll have, on the ground floor, we will have a brand new psychiatric urgent care. Never had this level of care in our region ever before. So 24 hours a day, 7 days a week. We will have someone there, and we want to be very easy to access. In talking with families and in talking with people even throughout the Avera system, I would say it happens multiple times a week, but for sure at least one time a week. Someone will call me and say, hey, my child needs this, or I need this, or and I don't know where to go. I don't know how to start this process. How do I get help for her? Or how do I pick a counselor? Or how do I do all of these things? So we want to be super easy to access 24 hours a day, 7 days a week. We'll have counselors there, nurses, behavioral health techs, and advanced practice providers. So a nurse practitioner or PA that will be there to treat patients all times of night or day, both for adults and for kids. Also on the ground floor, we'll have expanding our partial program. So right now we have 20 slots. Partial program is when you come for 20 hours a week of services. So instead of staying inpatient, I'm getting very intensive services, but I do go home in the evenings. And it's a really important place for people who sometimes need a lot more than just see your counselor next week. So we've always had 20 slots. We will soon have 30 adult slots. And for the first time ever, we'll have 10 adolescent slots. We've partnered with Sioux Falls School District and reached out to talk to them about this. And in the afternoons, we'll have 10 adolescents that would be there. They'd still go to school in the mornings, but in the afternoons would be with us. On the first floor, we'll be expanding some adult beds, and then we have some shell space built in. On the second floor, we're bringing our geriatric program over from the Prince of Peace and going from a 14-bed unit to a 20-bed unit. As the grain of America happens and the baby boomers age, we're definitely needing more geriatric beds. And then on the top floor is really dedicated to kids. So we have two programs there. One is the expansion of our behavioral health beds. We have 40 child and adolescent beds right now. In the new, we're adding 14 more, so we'll have 54 beds. As I said before, we just went through the busiest summer. We've been very close to 40 almost every day, and we've overflowed into our main campus pediatric unit on several days. That had never happened before during the summer. So it's an extremely hard thing to be, completely full and tell a family whose child is usually struggling with thoughts of killing themselves that we've got no room in the inn. So we need to solve that problem. So excited about having that piece open here in the middle of March of 22. And then the last program we'll have on that top floor will be adolescent addiction program. So just like it's kind of your traditional 28-day program, similar to what we have at 69th and Louise for adults. We will have a world-class facility for adolescents who are struggling with addictions.
And I'm going to change direction a little bit. Dr. Boysen, we've been focusing on in-school care, but the school really cares for children year-round, because you have summer programs, you have after school. So how do you look at helping to impact children during those times too? And how important is that after school program to those children rather than going home to a house that might not have parents at it who are working several jobs?
After school programming is important for the whole child, for the family, for the community. We have multiple opportunities at all levels for students to be involved. So at the elementary, we partner and have our after-school program in all of our elementary buildings, our Kids Inc. program. And then at the middle school, we partner with the YMCA and Girls and Boys Club to offer programming in those buildings or take them out to different opportunities. They might go bowling, or they might go do the great shots, to do some different types of activities to give them experience. And then, of course, at the high school level, we have all the activities and the clubs that go along with that. But it is important, we know we've tracked information, and when you look at students that are involved, they do better academically, their attendance is better, And so if we can get every student engaged in an activity, whether it's an after-school program as a young student or in a club or an interest area, and then at the high school in some activity, we know that they are going to be more productive in their school life. And it might be something that your neighbor isn't interested in, but you are. I mean, we have a lettuce club at our high schools, and I had to make
What do you
sure
do in
that
that club?
they really do. There's a competition to eat lettuce,
Oh.
and so it truly is a lettuce club.
Healthcare loves this kind
Yeah,
of
I
club. There
know.
needs to be more of that.
It's
So
funny
it is-
because we've been calling marijuana the devil's lettuce in our office.
Oh.
Not that
I'm
kind of
half
lettuce
kidding.
club.
I'm half kidding, but that someone will say that as a joke, so that's funny.
So it is, so we have all kinds of clubs and opportunities for students to be involved, but really looking at how do we expand those opportunities? And I know Mayor TenHaken has dreams of more community, and Dr. Stavum, we're working together to create that community, look at that. How do we all come together to provide after-school opportunities for students? Because even if I do have a parent at home, is there something for me to do at school? Is it a robotics, or is it flying a drone? Are opportunities there that I wouldn't have if I went home to my house, or bring my friend along? So we can stay at school, we can be involved, and then maybe my mom and dad come for a learning opportunity too. So
Mayor, what do you want to add to that? I know you've been working on, what do we do with children when they're not in school?
Yeah, I mean, it's a little bit of a pivot from, mental health, but when you talk about caring for kids, it's the entirety of the child, the mind, body, and soul of the kid. And I was on a radio show last week, and the host asked me, he's like, if money was not an object and you could wave a wand and take care of any problem in the community, what would it be? And I said, money would not be an issue for after-school care, and anybody who needed out-of-school care could have access to it. There were daycares all over the place, because I think that's a workforce challenge for us. Not enough daycare. I think that whole industry is tough right now. And we operate 5 community centers from the city of Sioux Falls, and they're attached to school district schools. But I think we can be doing a lot more and do them a lot better. And Dr. Stavum and I have had several conversations on this, and how do we collaborate more closely to provide better, what we call out-of-school care opportunities. And I think when you say after school, it applies to that, 3:30 to 7:30, but out of school, summer, before school, kids that are out of school, what are we doing to take care of the literally hundreds and hundreds and hundreds of kids that don't have a good place when they're not under the care of our school district? And that's what leads to some juvenile crime issues. That's what leads to bad decisions. That's what leads to some of the mischief. That's what honestly gets kids off the right track, is when they don't have the care they need in the home. And if it's not happening in the home, what's our responsibility as a community to do that? And I think it can start in some of these out-of-school centers and out-of-school activities. The related piece to that, though, that often is connected, is the lack of transportation as well. So it's one thing when you talk about equity in a community, and you provide all kids equal access to soccer. Well, if they don't have a way to get to Yankton Trails, where all of our soccer fields are, is that an equitable program, or does it only benefit the kids who have parents who can leave work and take them there or have rides there? And so there's the out-of-school care piece, there's a transportation piece. I think they need to be solved together to help kids.
I think that's a really important point, because when we look at our community health needs assessment, because our nonprofit hospitals are required to conduct one, and we work with the city of Sioux Falls to do that, and it's all tied together when we look at these issues. Behavioral health is one of our top issues every time, but so is transportation, so is housing. It is all tied together to make up the holistic mental wellness of somebody. So that's why it's hard to talk about one without talking about all these aspects today.
And our new public health director, Dr. Charles Chima, has he spoke to this group before yet? You got to have him in here. I mean, he's
I just
he's
met him.
incredibly brilliant guy, but he has such a strong public health mind. And those social determinants of health, he's really focused in on, whether it be food access or transportation access, or all those things indirectly can affect someone's mental psyche as well. So they all work together, and too often we go straight to, it's like, well, this is a food desert, so we need food here. But well, what's the other corresponding challenges that dovetail alongside that, and how can we focus on more than just the food piece or the transportation piece? They got to all work in concert together.
Absolutely. Thomas, anything to add to this conversation at all?
No, I mean, I think Mayor Munson said it really well.
That's you're getting closer now. You're one mayor away.
Never gonna live that one down.
You're never gonna live that down. I know that.
I want to leave a couple minutes at the end for all of you to ask questions of our panelists, and those of you who are joining us on social media and on Facebook. Even though we were pretty tough on social media earlier, we'd welcome that you ask questions also. But first of all, I want to give each one of our panelists an opportunity to just, what can this group of people do to help you, to help this cause? What does success look like when we're working through this? So Dr. Boysen, I'll start with you.
First, thanks for allowing us to be here today and to speak to you. The business community in Sioux Falls is so supportive of the Sioux Falls School District, and we thank you for that. Thinking about mentors, that's a great way to support students in the community. So allowing your employees to off 1 hour a week to mentor a child is a great way to help support. But then also thinking about your adults, and your adults may be married to one of our teachers. You may have students in the school district, but one thing that we have seen is, how do we help our adults in the Sioux Falls School District? And that's that employee assistance program, really helping them to connect. Like you said, Dr. Otten, that often people don't reach out. So how do you embed that practice into what they do every day? So how do they access your employee assistance program annually or routinely, so that way when something does happen, they can reach out and it doesn't seem foreign to them? We know that we have employees of all age groups, and so I might, as a millennial, not me, but some of our teachers, they will be more comfortable texting through that employee assistance program, or somebody else might feel more comfortable emailing, or somebody else with a in-person or on the phone. And so allowing all those formats for communication for your employees, so that way they can get the help when they need it. And I think that's the piece, that it's okay to reach out for help, but there's multiple layers there to support them.
Thank you. Thomas?
I think two different questions there. The first, just, what would be mental wellness? I would say the first step of that, I think, is really, as I've mentioned before, getting to the point where we ask for help. I just saw a presentation on kind of how we come out of COVID, and what is the most important things. They asked a prominent psychiatrist, what's the most important thing we need right now? And his answer was exactly that. We need to get to a place where it's easy to accept help. So I think that's step one in what mental wellness looks like. I think step two is then providing world-class treatment using evidence-based principles. Most of the behavioral health disorders are extremely treatable. Depression, for example, is over 80% first attempt treatment you will be well. So while it's, 80 isn't 100, if you had 80% success treatment first attempt with cancer, we'd say, boy, that's pretty good. Or, with any other disease state. So these are very treatable diseases if we can get past step one. Your second question, of kind of what can we do, or what can our community do? I mean, a few different things run through my head. Certainly, I would piggyback on what Dr. Boysen said. It is really important as business leaders to allow employees to have time off to go to counseling sessions, or to go to their child's counseling sessions. I think those are really critically important things, and sometimes not as easy for businesses to do as it should be. I see Tim Crominga in the back of the room, and he's in my head telling me, this is my one opportunity to tell them that we have a $22 million capital campaign going on right now. What can you do? You can certainly invest in that campaign through the generosity of the Helmsley Charitable Trust of giving us $8 million up front and then matching dollars. We're trying to raise $22 million. We're $20 million the way there. Or if that doesn't tickle your fancy, we had one of our psychiatrists give us $10,000 last year to open a clothing closet for patients. Many patients who come to us have nothing but what they have on their back. And so we've created a clothing closet with brand new clothing where they can shop and make sure that they have something additional to wear. So potentially, I would say even more important than either of those things is just really creating a community where we can make a difference. I think I'll give you a homework assignment since we're talking about teachers. Go home, 2.5-minute video that will be well worth your time. Go to YouTube and type in "Make an Impact." And it's a 2.5-minute video. I think the picture at the front it should be the first one, inspirational video. I think it's a heartbeat. But essentially, the video will go through and it talks about, how things, you should live for things that matter. And spoiler alert, the last phrase of it, which I think really gets me every time I hear it, is, when you were born, the whole world rejoiced while you cried. Live your life in such a way that when you die, the whole world mourns while you rejoice. And I think it's a powerful reminder of, we have opportunities every single day to make an impact. So I just encourage us to do that.
Thank you, Thomas.
I can't top that, man. That's incredible, But two things that come to my mind. One, if you have an EAP at your business, continue to fund that, because you don't know the impact that an EAP has. It's an employee assistance program for people who make anonymous calls to a counselor and just get their head straight. And we use it a lot at the city. Our first responders use it a lot. They see some heavy stuff, and I think EAPs are incredibly smart investment in your employees. Obviously, I'm going to pitch mentoring, because you just don't know. You may be that one person in someone's life who can recognize the need, the challenge that a person is experiencing before it gets too late. So mentoring, obviously huge. And then the third, I try and think about this a lot, is some of these people we're serving in the link, it's easy to think of them as less than you, okay? I'm the mayor, you're a drunk, and we're all the same, right? We're all the same in God's eyes. They have been dealt a tough hand. They have experiences they're going through that we can't relate to. They have diseases that we don't have. And so as soon as you elevate yourself above someone else, they don't become a person anymore, right? And you have to see them as people. And when you see them as people, you'll do anything you can to help, anything you can to help. So it's probably my wrap up, is just see those folks dealing with those challenges as people, as children of God that need us as a community to keep investing in them.
Well, you all did an incredible job of teeing up this topic. Let's see if there's any questions from our audience. We've got about 5 minutes to take questions.
First of all, thank you guys. I ask these questions in my own experience with the mental issue and behavior. City of Sioux Falls is growing to be very diverse community right now, and my involvement with those issues didn't help the patient they working with the school district in the past and the hospital. What we have, because the behavior and mental issue between the mainstream kids or adult is totally different with those kids and adult coming from different country, went through so many different trauma. Imagine 12 years old kids in Sioux Falls, his behavior and a 12 years old kids coming from reservation is totally different. In my experience with those staff, they deal with everybody with the same level. That right now the hospital and the school district have a better and more understandable counselor and other to understand the cost of those misbehavior of the different ethnicity and different culture in Sioux Falls to be more helpful and overcome the challenge they have.
how are we working on with diverse cultures? Because Sioux Falls and the school district has a lot of different languages that are spoke within it.
We do. In the Sioux Falls School District, we have 90 different languages spoken in the district, 5 prominent languages. But more so, how do we help students from different cultures and recognize those cultures within the classrooms and within the buildings, and really have our principals and our leadership teams and our counselors and our social workers come together and again reach out to those families. And we have liaisons that work with them to speak the same languages, but reach out to those families to help understand and build those relationships. Starting a community engagement center this year, and that will be located at the Axtell Park building. And that is, it has liaisons, it has our social workers, it has all the resources, new families coming to Sioux Falls to help support them, all in one location. And so that way a family can check in there, we can help get them registered for school, we get them connected with the liaison, and then take them back to the home attendance center to that school so they can get connected within that school. So really help to support that family. And again, then they have a person that they can reach out to, and then we can get them the resources they need. And we can help follow them through their career in the Sioux Falls School District. And that's our goal, is really to help them feel comfortable and feel like they have a relationship and that they have a home with us in the Sioux Falls District.
Yeah, just piggyback on that. One of the things that we've at Avera Behavioral Health really focused on, it's a great question, and it's a really important point, because you're very accurate that the trauma that many of the children have seen is something that nobody that was raised in Sioux Falls, South Dakota has ever seen. We started here a couple of years ago, going down to the Multicultural Center, and we've created a group down at the Multicultural Center with one of our therapists who's really, over time, really developing great rapport there. And I think it's a community that we want to reach out to in any way we can. So if there are additional ways or ideas that come forward, we're happy to listen to how can we do this better.
Other questions? I want to thank you for spending your time with us. Thank you for informing us of this important topic. And I think we all had some good takeaways today to go out, make a difference, mentor if you can, give back, look for those people who might be falling in that gap, and see how we can make a difference in the lives of children in our community. So thank you all for having us today. And thank you to our panelists.
I thoroughly enjoyed today's program. Thank you all for your time and expertise, and really enlightening, hopefully, each of us in this room today. Next week, August 23rd, we will have a conversation with Raven Industries CEO Dan Rickus, moderated by Downtown Rotarian Rick Melmer. Rotary is adjourned.